Overview of Medicare and Medicaid. Medicare and Medicaid are two government-sponsored health programs designed to assist different groups of Americans with medical costs. While both aim to provide healthcare coverage, they have distinct eligibility requirements, funding sources, and services. Understanding the differences is crucial for determining which program best suits an individual's needs. What is Medicare? Medicare is a federal program primarily for people aged 65 and older, regardless of income, as well as some younger individuals with disabilities. It consists of several parts. Part A, hospital insurance; Part B, medical insurance; Part C, Medicare Advantage; and Part D, prescription drug coverage. What is Medicaid? Medicaid is a joint federal and state program designed to provide health coverage to low-income individuals and families, including children, pregnant women, elderly adults, and those with disabilities. Unlike Medicare, Medicaid eligibility and benefits vary by state, as each state administers its own program within federal guidelines. Key differences in eligibility. The key difference between Medicare and Medicaid lies in eligibility. Medicare is available to anyone 65 or older or those with specific disabilities, regardless of income. Medicaid, however, is income-based and intended for those who meet certain financial criteria, such as low-income individuals and families. Funding sources and administration. Medicare is entirely federally funded and administered, meaning the federal government sets the rules and funding for the program. Medicaid, on the other hand, is jointly funded by the federal government and states, with each state having flexibility in administering the program according to its own guidelines. Coverage and benefits. Medicare offers standardized benefits, including hospital stays, doctor visits, and prescription drugs, depending on the chosen plan. Medicaid, however, provides more extensive coverage, including long-term care, dental, and vision care, which may not be covered by Medicare. The level of coverage can vary based on state-specific rules. Cost differences between Medicare and Medicaid. Medicare typically requires beneficiaries to pay premiums, deductibles, and co-pays, although some individuals may qualify for assistance through programs like Medicaid or the Medicare Savings Program. Medicaid is usually free or has very low costs for eligible individuals, with no premiums for those with very low incomes. Dual eligibility for Medicare and Medicaid. Some individuals may qualify for both Medicare and Medicaid, known as dual eligibility. These individuals receive the benefits of both programs, with Medicaid covering expenses that Medicare does not, such as certain out-of-pocket costs, prescription drugs, and long-term care services. Medicaid expansion under the Affordable Care Act. Under the Affordable Care Act, ACA, many states expanded Medicaid to cover more low-income adults. The expansion allows individuals who earn up to 138% of the federal poverty level to qualify for Medicaid, which has increased access to health care for many previously ineligible Americans. Choosing between Medicare and Medicaid. In most cases, individuals will not need to choose between Medicare and Medicaid, as they are designed to assist different populations. However, for those who are eligible for both, understanding the coverage and costs of each program is essential for maximizing benefits and minimizing out-of-pocket expenses.